It's another blow for the Welsh NHS as senior doctors, consultants and specialists, they voted in favour of strike action next month in a dispute over pay.
BMA members will walk out between the 16th and the 18th of April over the Welsh Government's offer of a 5% pay rise. The BMA says staffing will be like Christmas Day, with emergency care still provided, but all elective or non-emergency work postponed. The strike by consultants is separate to further industrial action by junior doctors, which is due to happen between the 25th and the 28th of March, so the end of this month. Dr. Stephen Kelly is on the line now, a consultant at Wrexham Maelor Hospital and chair of the BMA's Welsh Consultants Committee. Bore da.
Good morning to you.
So the dispute goes on. Doesn't seem that there's any sign of a resolution anytime soon. What do you hope this strike action might achieve?
Well, I think it's a very sad day that we've come to this. But what I would hope it would achieve is, we now have a 6-week period in which hopefully the Welsh Government will be able to come to us and we can have serious discussions on pay and try and move this forward. So we do have a time window where we'll see what we can do. But it is a sad day that to have got to this point, unfortunately.
Do you think it'll change anything?
I would hope so. I would say, I think there is, recognition. There is, we are at a point where we have lost so much pay that we have really little choice than just to say enough is enough. We've lost 30% of our pay in real terms since 2008, 2009. Put out in context, I'm still, for the first few months of the year, I work for free compared to what I used to do. And unless we take a stand and do something about this, we're going to just see people leave the profession, move to countries where there are better working conditions and much better rates of pay. They're just not comparable.
Do you though, Dr. Kelly, accept that the economy is in a very different state now compared to what it was back in 2008, 2009? You will know better than most the challenges of budgets in the current climate. The Welsh Government departments elsewhere that are facing a reduction in their budgets because of the extra funding required for the NHS. You've heard the Health Minister on this programme, Eluned Morgan, repeatedly say that if she had the money, she'd give it to you and to the junior doctors who are also striking for the third time at the end of this month. Where's the money supposed to come from?
Well, it's not really for me to work out where the politics of where the money comes from. We need to represent our members who've lost a third of their pay, which is just not fair. And I think what is also true is that hospital consultants who represent have lost more than any other public sector worker. So, yes, I don't disagree that other sectors may not have suffered during recent years, but we have lost more than any other comparable worker group. And that's just simply not fair. And we have to stand up for our members. And, we've done so much through the years of the pandemic, and then we come out at the end just to find that we have even further erosion of our pay. It's just simply not fair. And ultimately, if you want a service, then you have to fund it.
And if they don't meet your expectations, what then? Does industrial action continue, and how long for?
Things will continue as long as they have to do. So, we continue to be civil with our Welsh Government colleagues, but we just need a credible pay offer. I think there is, I would hope there's some recognition. They committed just last year to pay restoration. And at the very first opportunity, we received the worst pay offer of all of the nations across the UK. We didn't even receive an offer in line with the DDRB recommendations, which in itself are flawed. So it was the worst offer across the whole of the UK.
Those conversations with Welsh Government then, how frequently do they happen? When will you next speak to them?
Well, there are no official pay talks. So unless there is sort of money on the table, then there are no pay talks. However, behind the scenes, we're always willing to, we're willing to meet at any point. There are informal contacts where we discuss the what ifs, but really without any offer of increased money, things won't be taken forward.
Could you understand patients listening this morning to this who may be due for treatment on the 16th, 17th or 18th of April thinking, well, where does that leave me while we're at a standstill here between Welsh Government and the BMA? What about me? What about my loved one? What about my family? What does this mean for patient care?
No, absolutely. I think, it is very difficult, and we're very sorry for patients who have planned elective care cancelled on those days. That is not good. However, in the longer term, if we don't retain our staff, and paying people properly for what they do is part of that, then there will be no staff and the services will just erode and we will have less service. So going forward, there will be less opportunities to have those elective operations because we won't have the staff to actually do the work. So in the longer term, it is important that we solve this dispute, and through that, we will have the staff to actually run the service. Without it, our services will further erode as our doctors coming through choose to work elsewhere. People such as myself look to retirement, and then that will make the situation worse. So in the short term, yes, I'm very sorry for anybody who has anything cancelled on those days. We will work very hard to make sure things are safe. Christmas Day level of cover, things run safely.
What does that mean? I mean, when I say that Christmas Day level of cover, what does that mean then for these days?
What it effectively means is no elective care. So one of the things on Christmas Day is we provide all the emergency care that we do every day of the year, but there's very little routine work done because Christmas Day tends not to be. I think the difference would be, for example, perhaps on some other normal weekend days, elective care might run in small amounts. So it's just really a way of saying that we don't do elective care, that we just cover all the emergency care. It's the same model that has happened in England in their industrial dispute. So we know that we can cover things safely.
Just briefly on this, I know you're a consultant at Wrexham Maelor Hospital. What percentage or how many staff would be considered to be practicing medical consultants that will be striking at that hospital on this day? So what does it mean for your staff? How many?
Well, I can't give you exact numbers. What I would say is that we will have at least the same number of people we have on Christmas Day, or most in terms of that's similar to what we would have on a weekend. So all of our emergency staff will be in, all of the acute take patients will all be seen and as normal levels of staff. And it's just more the elective care, the clinics, the routine operations, those are things that won't happen.
Yeah, I'm just reading here that consultant and SAS doctors make up over half of the hospital-based medical workforce combined. Is that figure, does that sound right for your hospital?
Yeah, probably is about right to say. I don't know exact figures.
Thanks for coming on this morning. That was Dr Stephen Kelly, a consultant at Wrexham Maelor Hospital, chair of the BMA's Welsh Consultants Committee. We did invite the Health Minister, Eluned Morgan, onto the programme, but she declined. The Welsh Government said it agreed with the principle of pay restoration, but is unable to offer it until the UK Government passes on the funding necessary for full and fair pay rises for public sector workers. More on this on the BBC Wales News website. It's 16 minutes past 8.
Now, the UK